Welcome to this afternoon's work session. We are going to first take up any preliminary items for the next BOC meeting that a board member would like to discuss, if there are any.
Sir.
All right, hearing none. First work session discussion item is the Clayton County COVID update, and also as a note to the board, we will not be having presentations items number 2 or 4, and that's a legislative update and the ordinance of 2022-62. They'll be on the next work session. So we'll only have items 1 and 3 today. Chief Murkison, please.
Yes, sir. Thank you very much, Mr. Chair, Madam Vice Chair, members of the board. The chairman had asked that I come before you this evening and provide you an update, thank you, sir, on kind of where we are with COVID-19 and the fight against the county's pandemic, and kind of what the outlook is and where we're trending on some data specifically as it relates to Clayton County. So I've put together a presentation for you. I'll just kind of clarify all the data that I have pulled for you this evening. Is based off of CDC current guidelines and data, and is evaluated in the last 7 days from last Thursday. So this past Thursday is the most recent data they have, okay? So what I wanted to do is kind of give you what the CDC current data is for the United States, and this will kind of set the tone for you as far as how the CDC is currently tasking community levels. So they're listing them as low, medium, and high. And there's a number of metrics on the screen before you as to how they get to those rankings, but you can kind of see where the vast majority of the United States is resting as far in this scale in the low category. The COVID-19 community level is determined by the higher of the new admissions and inpatient beds metrics based on the current level of new cases per 100,000 population in the past 7 days. So as we go through this data, you will kind of see some of the dates of where the date ranges are referenced. So as we bore down just a little bit further into the state of Georgia, so occurring to the CDC 7-day metrics, new cases as of last Thursday were 2,883, and we had a percent positivity rate of less than 3%. You had 275 deaths, and then the percent of population that was greater than or equal to 5 years of age that were fully vaccinated was 57.9% of the state's population, and they had 36 new hospital administrations across the state, or admissions, across the state of Georgia. As we bore this down into Clayton County specifically, according to current CDC data, and this is in coordination in conjunction with the state health department, is at a low community level. Recommended actions based on the current level from the CDC are to stay up to date with COVID-19 vaccines, get tested if you have symptoms, wear a mask if you have symptoms, a positive test, or exposure to someone with COVID-19, wear a mask on public transportation, and then you may choose to wear a mask at any time as an additional precaution to protect yourself and others. As we get into the current CDC community characteristics, these become important as a community because we all know that COVID-19 has an effect on populations of color and those that have a large underlying comorbidity issue differently than it affects others. And as you see from the population data and as we work through some of the metrics, that will kind of start to shed a little bit of a light for you. So population county estimate 292,256. Population density is people per square mile. You can see that Clayton County estimate is 2,062.81 people per square mile. You can see the statewide estimate is 184 people per square mile, and the U.S. estimate is 94 people. So as we all know, Clayton County is a densely populated county. Household side average is 2.95, and you kind of see where we stack up against the statewide estimates and the U.S. estimates. Percent uninsured is 19.2 versus the statewide estimate of 13.7. 20% living in poverty. Percent population 65 years and older, 9.65 against the statewide estimate of 14.29. And then the social vulnerability index of 0.91, when you look at the social vulnerability index, their max score is 1. Okay, so when you look at that scale, we're at a 0.91 out of 1, and it's the same thing with the community vulnerability index. And then obviously we are a large fringe metropolitan community. So what does that mean as we look at cases and death in Clayton County? As we said, this data is through Saturday, April 9th of 2022. So total cases for the previous 7-day period was 50. That's a case rate in the last 7 days of 17.71, rolling average. And the percent change from the previous 7 days was down almost 90% over the previous 7 days before. Total deaths, we had less than 10. And when you see in any stat put out by the CDC where they suppressed data, anything less than a factor of 10, they suppress the data because it becomes statistically inaccurate. And you'll see some of that data in our testing, county testing, as to why the CDC suppresses that data. But they did have less than 10 deaths. So total cases are down 89% over the last 7 days, and then fewer than 10 cases, as I stated, are suppressed for statistical norming. Testing in Clayton County, the percent positivity is 1.33%. The change in the last 7 days is up 0.5%. Tests performed is down 13.77%. So over the last 7 days, there were 969.09 tests conducted. Now, when you look at testing numbers now, these are tests that were either done by a private health clinic, some other testing facility that is reporting to the state, or by a local municipality or health department. This does not obviously anticipate home tests because there's no way to track that and those data are not being provided. Okay, so these are just tests that are being reported to some health facility. Vaccinations in Clayton County. Total population that has at least one dose is 149,317. Fully vaccinated is 126,713. So you can kind of see how that stacks out. So percent of total population with at least one dose is 51.1%. Fully vaccinated is 43.4%. And then it's broken out by age ranges as we go down the rest of the chart. So you can see our greater than or equal to 18 years of age, at least one dose is 62.5%. Fully vaccinated is 53.5%. And then our population of seniors in the county, at least one dose, 91.5%, fully vaccinated, 81.5%, and that's as a direct result of the numerous senior vaccination events that we have held early on and throughout this pandemic and making the push to make sure we get our seniors vaccinated. So you can see the percent greater than or equal to 65 has paid off in that metric. As you look at boosters that have been implemented throughout the county, and this could be, this would most likely be the third booster. We haven't done a whole lot of the fourth booster yet. We're still assessing the requirements for that. So there's been a total of 42,775, which equates to 33.8% of fully vaccinated population with the booster. And then you can kind of go down the metrics and see how that lives or how that spans out over the other age groups. Some COVID-19 vaccine recipients are recommended to receive booster doses, and then it gives you a lot of other details around those specifics. And then the other indicator for this chart was the count of people who received a booster dose indicates anyone who is fully vaccinated and has received another dose of COVID-19 vaccine since August 13th of 2021. This does include people who received booster doses and people who received additional doses. So the nomenclature is dependent upon which initial series you had and whether it was an additional dose, if it was a Johnson & Johnson, which was a one-shot, or Moderna or Pfizer, which was a 2-dose series, but they consider that a booster as just an additional dose. So it's really working through the semantics of what you want to call it. When you look at hospitalizations in Clayton County, this is a metric that they tend to look at a lot to kind of gauge where a community lies and whether or not it's coded as low, moderate, or high risk. New admissions of confirmed COVID-19 per 1,000 Our 1 per 100,000 population over the last 7 days was 2.3. That was down 10%. Percent staffed inpatient beds in use by patients with confirmed COVID-19 was down 0.3% at just 1.5. And then percent staffed ICU beds in use by patients with confirmed COVID-19 was down 0.7% to 1.9. So that trend is continuing to follow the other trends we see with the reduction in cases, the reduction in positivity rate. Obviously, as that goes down, we expect to see our hospitalization rate go down as well, and those are ones that are in with confirmed COVID-19. I did want to share this slide with you because I think it speaks to kind of where we are in the progression of this disease. So kind of what this lays out for you are the variants that are in Region 4 according to the Health and Human Services, which the state of Georgia is in HHS Region 4. And what this kind of shows you is the swing that we've seen in the variants that have come out. You can see that the orange color on the graph is the original Delta variant that spun from the original COVID-19. You can see that the Delta variant has all but died out. We got the original Omicron, which came out and which was B.1.1.529, was its genomic sequence number. So you can kind of see how that Omicron took off and dominated kind of where we were. And then you're starting to see the next sublineage of that original Omicron has now morphed into what is known as BA2. And it's actually now starting to take over and become the predominant strain. The interesting thing about it is even though it's morphing and it's changing in its actual structure between the amino acid differences and the differences in the spike proteins, is we're not seeing a steep rise in cases. So even though the BA2 variant is starting to make its surge, as you can see as of data 4/2 of 2022, it's over 50%. I think it's 59.9% of all total cases have been deemed to be the new variant, but yet our cases are still on the decline, which is what we want to see. So as we've heard from the health experts and we've talked about, the more these diseases and processes morph, the more transmissible they become, the less severe in their symptoms and output that they become. So we would expect to kind of see this transition in the process of COVID-19 as it continues to morph and evolve. So we do not expect BA2 to be the last variant that comes out. We'll just have to kind of see where we go from here. Current testing protocols, we've discussed this at several board meetings, but I just wanted to reiterate to the board, we've not changed anything from an employee management standpoint as it relates to testing. So COVID testing and employee surveillance is conducted in accordance with BOC Policy 902, specifically Section 902.10, and has become a model for surrounding governments. Policy 902 is annexed in the Continuity of Government Operations Plan for managing an efficient and resilient workforce for over the last 24 months. Policy 902, even though it's part of the Continuity of Government Operations Plan, can be implemented on its own, does not have to be a part of a widespread emergency declaration. The Continuity of Government Plan is anticipated to be able to function in and of itself and outside of the county's EOP. And that plan is put into place anytime the chairman deems that we need to deviate from our current standard operations within county government to continue to provide service. Rapid testing, PCR testing, and differential testing between SARS-CoV-2 and associated variants, influenza A and B, and RSV, which is the respiratory syncytial virus, are still ongoing at Clayton County Fire and Emergency Services headquarters. All testing is offered free of charge as supplies have been provided through the CARES Act initially and through continued ARPA funding. And then testing provided by CCFES Mobile Health and Wellness Clinic staff is in coordination with Human Resources and the individual department head for employee benefit management. So what we've seen in those numbers, and these numbers will closely follow the spikes in our variants, as you can see, dating back to August 20th of 2020. You can roll through January of 20 or December of 20 and January of 21, we spiked. You can see we were testing 576 that month. January we tested 585, and you can see the corresponding positivity rates as the original Omicron variant started to fall. So did our testing numbers. We got all the way down to 32 tests for the month of June with just one positive. Then you can kind of see the uptick again around August, and then the most recent uptick in December with the new variant that came out, and then you could kind of see those numbers have dwindled down to this month to next to nothing. So the reason why most data under 10, as I said, is suppressed is when you look at April 22 and you say, well, why did our positivity rate go to 20%? Well, it's because 1 out of the 5 we tested was positive. So when you get such a small sample group and you get 1 positive out of that, it overinflates your positivity rate. So most of the time, anything under 10, they'll suppress the data, because if you published a positivity rate of 20%, people are going to think it's widespread, rampant in the community, which is just 1 of 5 people tested positive. But that's kind of an example, and I almost took that out, but I wanted to leave it to explain the suppressed comment at the front. And then you can see the corresponding graphs as to what our peaks and surges were within the county and where we sit now. This data is accurate as of yesterday when I submitted this to the board. So as of yesterday, we had tested 5. And that's county level employees, our people, police people. If they're a county employee, they're included in that number. And with that, sir, I'll be glad to attempt to answer any questions the board may have.
Well, I thank you for the information you've provided. One question I have right quick is, with the new variant, how effective are the vaccinations that we've had so far? Is that still relevant to the new variant?
How they are addressing that question is the vaccines are still relevant in the fact that they have been proven and do shorten the severity of your symptoms. They are still preventing people from having to go to the hospital and having severe symptoms. How it specifically relates to the BA2 variant, I don't think there's enough data out there yet to clearly say it affects the BA2 variant specifically. What it does still impact is the severity of your symptoms. So they are recommending, if you're not fully vaccinated, still get fully vaccinated, because they are seeing shorter cases, less severe cases, and hopefully cases that are not causing people to go to our local emergency rooms, which are still struggling amongst the personnel shortages.
Any other questions for Chief Murkison?
Yes, Chief. Is there a difference between the, say, the Pfizer or Moderna, the first shot, second shot, and then the booster? Is that the same, basically the same shot? So now that they're coming out with that 4th shot, that'll be the same? Okay.
Yes, ma'am.
Okay.
The only thing that changes in dosing is for pediatrics. So once you get under a certain age group, then the actual dosing itself changes. But outside of that, it's the same exact. If you had Pfizer to begin with when you got fully vaccinated,
Right.
then every dose you get, that's the boosters that we have had in the past are Pfizer. That's the only one that's out there right now. So it's the same exact shot that you got the first 3 times.
Okay. Okay. Well, I'm ready whenever
You ready
for the 4th.
Right.
Yes.
Amen to that.
And that booster shot is lasting how long? They say, is it 4 months, 6 months?
If you could answer that, sir, then
I know they have been.
I think the safe estimate, they're saying that studies have shown it starts to wane at 4 months. But what that percentage is by the time you get out to the 6th, I think is going to depend on the individual, because they're also now coming out studies out of some of Europe that have been looking at this variant, the new variant, a lot longer than we have in the United States, are also starting to study what's the effect or what's the protection that's provided from people that have been infected with either Omicron, the A.1.1.529, or the BA2 variant. So they're starting to look, because they are saying that now provides substantial protection for those against future reinfections. So now the question becomes, if you've previously had COVID, which we all know folk that are fully vaccinated and boosted are still continuing to catch it, but what role is that playing into the efficacy of the vaccine or the booster, and does that tend to run that out? I think part of the struggle in that is there's not a lot of data around that just yet, looking at all those categories. So as a general rule, you'll hear them say that 4 to 6 month time frame. So, but it remains to be seen, is this every 6 month initiative, or, you know, at what point does it become similar to, I don't want to say like, but similar to a flu vaccine that's recommended you get every year. So I think we're in that transition period where a lot of those questions, I hope, are started to become answered and cleared up, so we know how to move forward.
Great, thank you.
Yes, sir.
Any other questions? Well, let me say this. One reason why I asked for this presentation is as we see the numbers starting to come down, and I've been asked numerous times in reference to modification of our mask mandate, that I wanted to make sure that we got some accurate and true information. So I appreciate the information you provided, and to the board, I would ask that you would consider this information and see how we would want to move forward with our mask mandate. Modify it, do away with whatever this board decides to do. But I do think at this point in time, or at least within the very near future, that we look at some modification in some form or fashion. Thank you, Chief. I appreciate you.
Yes, sir. Thank you.
All right. Next up is comp plan amendment for transit supportive land use. Mr. Ejiki.
Yes, sir. Chairman, Vice Chair, and Commissioners, good evening. This is a continuation presentation for MODA. I'm going to speak for a brief moment to kind of give you all a perspective as to where we are as staff and what we have done so far. MODA presented the bigger concept of their BRT project on February 22nd work session. Today, they're going to focus on areas within the unincorporated Clayton County. But before I ask them to come up and address you all on where they're going with it, I would like to share with you what staff has done so far and how we are looking at it from a staff perspective. As a baseline, we are mindful and working with what we already have, which are the following: the Basemore study. As you all know, the Basemore study created the Old Dixie overlay and the Mountain View, and in those areas on Terra, it is a substantial study. We're also trying to make sure that the vision of our LCI application to ARC is intact. That vision of that LCI is dubbed the Gateway Project, which is gateway into the county. It happens to be that other jurisdictions of the county are part of it, but that's what it's called. We also have sought input from the Development Authority and also sought input from our Office of Economic Development. The reason for those meetings that we held with them is to not create a product in a vacuum. The plan is to create something we can actually market in the county. As you all know, there's a lot of studies out there on the shelf. So we're hoping that when this is done, we can truly push the idea and invite folks to come look at what we have. And more importantly, of all the things we are doing so far, we have met with the district commissioners mostly impacted and heard from them because it centers in their districts, getting an idea what they are thinking, and they've given us, kind of explained, not completely. Each one of them shared and still wanted to keep meeting to improve that discussion as we go. So, our expectations as staff that the TOD clusters, the transit-oriented development clusters, it's attractive to developers so that they can come. A plan that enhances our LCI project application, a mixture of decent housing choices, and economic development clusters with job centers in them. It might sound lofty, but it's not. We're at a point where we have to push these ideas, put this in place to realize this. So, in addition to MARDA's ridership data, which we all know is the basis of what they do anyway, we have requested from them to submit to us data that supports economic development, so that at a point where staff is asking the board to approve something, we can justify that, at least as our minds and eye can see, that is a workable project. So with that, I will call on Mother to share with you the rest, what they have prepared for us this evening. Thank you, Commissioners.
Good evening. It's a pleasure to be here again tonight. And thank you for the introduction, Patrick. What we are focusing on this evening is the next step that MARTA is encouraging Clayton County to take, which is updating your comprehensive plan with a brief amendment at the back that really just demonstrates to FTA that, yes, Clayton County has the policies in place that will support land uses that ultimately will support this major transit investment. So this will be a brief review of what we showed a couple months ago with what these station areas are in unincorporated Clayton County. Again, there's 5 major ones. Some of them you share with your other jurisdictions. These were some of the... Okay. I was just going to roll with it. Yeah, there we go. So as you are aware, comprehensive planning in Georgia, they're very high level. They're long-range plans. You update them every 5 years. Y'all did yours in 2019. The Atlanta Regional Commission worked with your staff to produce yours, and your next update is due on October 31st, 2024. Now, there's a system in place with the state when you can update your comprehensive plan, primarily to address a changing circumstance. And in this case, the changing circumstance is that MARTA is being very aggressive in moving the BRT plans forward along the South Lake alignment. And unfortunately, the update in 2024 will not be done in time to reflect MARTA's application to FTA, when FTA will be looking for the evidence in your plan that Clayton is ready for transit. So again, we will be applying for that funding this June, so that's why we're on this very aggressive time frame. The FTA, again, was going to evaluate the entire South Lake BRT for those transit supported policies, looking at your comprehensive plan, Riverdale's, Morrow's, College Park's, and it's really critical that we are able to show that Clayton County is on board from a land use perspective as well. So what will be in that amendment, it'll be a brief overview of that South Lake BRT project. We'll have a little bit about existing conditions and those preliminary development concepts that we've already shared with you all. We'll have some recommended goals and policies that will support station area development. Again, a lot of this is already in tune with what you have in your comprehensive plan. It's just elevating it and making that louder. We'll be proposing a couple updates to your future land use maps and your development node map, and a few minor additions to the community work program. This is the schedule. This reflects that same timeline that Patrick shared with you a few moments ago, just in a different format. Your staff has been great to work with. We will be coming to your community info meetings, talking to the zoning advisory group. We are happy to come and chat with each of you individually to address any concerns that you might have. Patrick has requested that economic development data from us. Just 2 quick notes about that. We can provide data on what BRT has done in similar communities in the country in terms of that boost in development investment. We do not have Clayton-specific information at this time. If you recall, MARTA's been awarded that TOD pilot study from FTA. In that study, there's going to be a significant market analysis, and that's the study that would really dig into each of those 5 station areas and evaluate by station area what those opportunities are. So with that, so in our role as MARTA, we'll be providing that technical assistance, working with Patrick and his staff in developing that amendment, coming to the public workshops, interacting with folks. We do have a survey out right now. I believe we have almost 100 Clayton residents who have chimed in, most of which have been very supportive so far about these proposed goals and policies. And what we're asking for from the county is to just help make sure that this amendment moves forward and is at least in process when MARTA applies for FTA funding in June. So with that, I'm happy to answer any questions you all may have at this moment.
All right, good information. Are there any questions? Any questions?
Thank you for your presentation. Good to see you today.
too.
If you don't mind, just review real quick for the board, the TOD pilot study program that we were awarded funding for, because I know a lot of times we will see other jurisdictions getting funding for transportation, which this is included in that award.
Yes, absolutely. So last summer, MARTA applied for a grant from FTA. They've been awarded almost $1 million worth to study that South Lake BRT line, and that's the one that starts in College Park, goes through northern Clayton, Riverdale, over past the medical center and into the city of Morrow by the South Lake Mobility Center. So that study is going to have 3 main components. One is that market analysis that I mentioned, and that's going to be looking at every individual station area and looking at what those specific opportunities are for investment. That's one piece. The second piece will be actually working with Chief Murkison on some stormwater management and flooding pieces. That's in response to the climate resiliency pieces that are now required by the federal government. And then the third part is looking at 3 different corridors. We have one in the city of Riverdale that will be looking at 85. We have a piece of Terra Boulevard that would be integrated with y'all's LCI plan if ARC awards that to you guys. And then we have a piece in College Park along Old National Highway. And those parts are really going to be looking at how do we make those huge roadways that are really important to people work for different modes. So not just the BRT and not just cars, but bicyclists and pedestrians as well.
Awesome. And where are you going to get the funding for the comprehensive plan update? Are you all looking for us to put it on our agenda and then we're paying for it, or is it coming out of the funds that have been awarded?
MARTA is writing it, so the only cost to the county is basically through your staff time and helping facilitate the process. But no money is being requested from you all.
Good stuff.
Any other questions?
Yes. When talking about BRT and the development around everything, is the county responsible for all of that development, or does MARTA have a share or some kind of funding that they assist the county with?
So I can speak to that a little bit. So typically what MARTA does with TOD and their structure is when they own the land around a station area, they are the ones that are really promoting that development within their own land. So right now, MARTA doesn't own any land along the South Lake alignment. As that project progresses and MARTA gets right of way, they would start to own that land, and then they would be promoting that development around their specific areas. Now, in areas where MARTA doesn't control that land, they would be looking for partnerships with different jurisdictions such as you all, City of Riverdale, College Park, City of Morrow, to help make those station areas a little more mixed-use oriented and dense and walkable.
Do you all come with suggestions and all?
On how to do that?
Yes.
Oh, yes, absolutely. So that's a big part of what we've been doing for the past couple of years with this transit supportive land use study. So one of the big recommendations for that is some adjustments to your zoning code. We have a very large, very boring document that goes line by line throughout that code to say, okay, here are our recommendations for some very specific changes. And what we did was we really made very specific ones. So you say, you know what, we like this one, we think this works, maybe not this one. So it's sort of a menu of recommendations that you can pick and choose what you think would be best.
So it will be in other areas other than just around the South Lake project?
So that's the zoning recommendations or all of it?
The all of it.
So this project right now is just talking about that South Lake alignment. So the alignment along State Road 54, that one is still being studied. So MARTA is currently looking at a BRT option for that corridor. So the South Lake corridor is further along in the planning because MARTA knows the mode that we're going to apply for. So that's at a faster timeline. So all of this planning will still need to happen for the State Route 54 station areas. But again, that's a little further in the future, and MARTA is really focused on the South Lake BRT right now.
Well,
I'm sorry.
no, I was just going to say consider Highway 85 too, because it seems like that's where it's starting.
So through Riverdale?
Yes.
Or, oh yeah, so that's part of the alignment. Let me get back for this up.
Well, I know, but they're concentrating on.
Right, so that red line, so the South Lake, actually right where the South Lake BRT label is, that whole part is State Route 85.
Starting there. Well, it seems like it's starting.
So it actually starts up in College Park, at the College Park
That's what I
Metro.
mean. And that runs into 85 and comes on down.
Number 2 is, that's Highway 85.
I know, but you're going to skip all the way down. Well,
So there's 3 stations in Riverdale that we're not showing on this map since we're focused on unincorporated Clayton County here. So there are a number of areas that we don't have on this presentation because this is primarily looking at unincorporated Clayton
but
County.
it just seemed like you're starting backward. You know, instead of up top with 1, you jumped all the way down to 5. I mean, just consider that. You know, I just think 1 and 2 need some consideration, 1, 2, and 3.
So so in terms of, I'm sorry, maybe I'm not
In terms of
understanding.
my district.
So all right, so let me try to make sure I understand. So all 5 of these stations are going to be focused upon,
Right.
right? And so then we'll also have the College Park stations that we're looking at, the City of Riverdale stations, and the City of Morrow stations that we will be working with those jurisdictions. So in total, I believe it's 13 stations on the South Lake BRT
I'm just
line.
thinking because it seems like the South Lake area was late to the game. And everything really started, so someone on the MARTA, with the MARTA group should know that actually everything started up in that Norman Drive, College Park area. So, I mean, just for FYI.
Yeah, and that is, that's an area that we will be looking at. So we won't be skipping around, but really we're focusing on all these different jurisdictions with everybody.
Thank you.
Yes.
Any other questions?
Yes. When will the market analysis be conducted?
The
Scheduled to
pilot
be
TOD
completed?
study?
Yes.
So that is a great question. MARTA has not started it yet. They are determining their path forward for how they're going to staff that project. So my recommendation to you all would be to get in touch with your MARTA representatives to ask them about that and maybe give them a little nudge.
Okay. As well as, right now, there is no ownership of property by MARTA. But will this amendment begin to give ownership or assign any type of ownership to MARTA as far as property goes?
Not directly. So what this amendment will do was it will demonstrate to the Federal Transit Administration that Clayton County is on board with this project. And FTA is the one who's going to give that first big chunk of money that MARTA can move forward with that process. And now that's the first step in a long process to get BRT here. That's going to take, I believe, about 3 or 4 years, but ultimately that's that first step that will be needed in order for MARTA to begin to acquire right-of-way and do more of that detailed planning towards implementing it.
So, but with the amendment, if it is passed, voted on and passed, would grant ownership in theory to MARTA? Is that what it's
No.
doing? Okay.
No, all
Be
it would
sure
do,
of that.
it's a very high level look,
Okay.
so it'd be goals like, encourage higher density and mixed use around your station area. So it's not getting to that parcel level,
I just
it's not
wanted-
doing anything for MARTA
Okay,
specifically.
thank you.
Any other questions?
I just want to add, this is something that actually, thank you for what you brought, but listening to the questions, I think it's important for us to know that this is something that the state actually is asking for as well, dealing with all modes of transportation. We're going to be digging in deeper into making sure that those transit-oriented developments and those comprehensive plans are coinciding. So it's not can't transfer any property or anything, but it has to be in concert. And as we know, that the state of Georgia has been really lax in pulling down federal funding And this is one of the first big projects with the BRT that the state of Georgia's been able to pull down some federal funding. And in order for us to continue to move that needle forward, we've got to get this piece done. And it has to happen in every jurisdiction that's dealing with transportation. So thank you for your presentation.
I need to get you with all these presentations with me.
No,
Thank you.
I do enough work at ATL.
Appreciate that.
No, my pleasure.
Any other questions? Again, thank you for your
Yep,
time and your
absolutely.
presentation. This is the last presentation for the evening, so we stand adjourned.